Rebecca, what are some of the most valuable non-technology policies and procedures that can be implemented from the risk management perspective?
From the healthcare standpoint, a risk manager is not a risk manager is not a risk manager. Every healthcare entity that I've done business with, and because I was a lawyer in private practice before I came to this job, is different. So don't make assumptions about where that person lies within their organization or what their power structure is or what their influence is in the organization. You need to get some specifics from them. Find out who the players are that they have to sell this to, and give them guidance based on that. Don't assume that all risk management departments are created equal. But I will say that traditional risk models of thinking can be very helpful here. In other words, and we're going through this right now, you can encourage your folks to use a traditional risk assessment to help the IT department guide their priorities. For example, if you have an organization that's trying to work through switching over to encrypted devices, and a lot of folks, I think, especially when budgets were lean, didn't invest in that kind of a technology. And so as you're looking at, well, where do we start to get this stuff up to snuff, the risk management department has to be a big part of that so that we can help them do a strategic risk assessment to figure out where you're going to get the most bang for your buck, because you want to start with the devices that are going to present the most risk if something happens to them. I would also encourage your clients to use risk analysis and risk assessments when they're looking at new lines of business in terms of what kind of data are we going to be taking in, how are we going to manage that data, how is it going to fit into how we manage all the other kinds of data that we have, so that when you're integrating new lines of business, it's done in a thoughtful way with the eye towards mitigating risk from the very beginning. Obviously, the organization has to make sure that it has best practice policies and procedures on data collection, access, storage, and transmittal. But I also need to caution you, and we have this in the healthcare arena a lot, you don't want a perfect policy if it can't be either enforced or the workforce can't live with it. You want to set expectations and enforce consequences, but you also really want to emphasize prompt reporting through the appropriate channels. You know, you don't want somebody going on vacation and leaving their laptop at the airport and you don't hear about it until the airport calls you. And so reporting is really important, and making that clear to everybody and making it easy and sort of something automatic where they don't have to think too hard about it and they don't have to hunt for who's the person I call if my laptop gets stolen. I would also advise your clients to engage their physical security experts, so their internal police force, as it were, to use them as a resource for physically protecting these devices. In other words, do we have appropriate policies and procedures for how we're going to lock up the office at the end of the day? And who's going to be responsible for that? And are we tethering these things if they're a laptop that's used as somebody's desktop computer? So make sure you use those internal resources. I would also suggest building data security assessments into performance evaluations for at least certain key personnel. Who are the people who, if something goes wrong with their device or if something's lost, is going to cause the organization the biggest amount of risk? Make sure that those people in their job evaluations every year, their bosses are looking at, are they being diligent in protecting their data, and are they following our policies and procedures? Well, I think one of the most important things for me as a director of risk is having a plan in place ahead of time, a breach response plan. So what are we going to do in that first critical 24 to 72 hours? And what are the key pieces of data that I need to ask my people to find out, my internal security people, the physician whose laptop it was, whomever? What do I need to collect so I can go to coverage counsel, or not coverage counsel, but to claims counsel and say, we've got a breach, these were the data points, these were the number of patients involved, and they live in this many different states. Because the faster I can get that information, then the faster we can assess what we really need to do, and then we can mitigate the risk.